Welcome to part 2 of our conversation about doing a little bit of case study to give you an idea of what kind of clients that we work with. I'm Dr. Leslie Worth.
I'm Dr. Kelly Frank, a pelvic health physical therapist.
Oh, and I'm sex therapist and marriage and family. I always forget to do that part.
It's okay. It's just, it's what you know you.
So last time we kind of started with you, so I thought we'd start with mine of what I kind of see in my office. And once again, this is not anyone specific, but kind of just like an accumulation of a lot of cases that come through my door. And what I see is clients coming in, male or female, coming in by themselves. They either had seen a urologist or a gynecologist, or maybe they had started working with a pelvic floor therapist on a physiological issue, and they're trying to fix the partner issue by themselves, which is not helpful. I've definitely seen where clients have made leaps and bounds, especially with their pelvic floor PT. But as soon as they get into the bedroom with their partner, it's like they're back to square one. It's like a game of chutes and ladders. Like they slid all the way back down. Yeah. And we're trying to work together to bridge that gap of like, how do you bring the partner into the PT part? And then how do I also bring the partner in of them understanding the emotional piece? And how do we make the pelvic floor exercises not so clinical, but make them part of foreplay? Because sometimes that is what we need to do. Is it's not just we do these exercises for 6 weeks with my pelvic floor therapist and I'm good. It's no, we will have to do this forever sometimes. It's part of, it's like learning how to live with like a chronic thing and how do you implement it. And I've had some clients where they're like, they go and do these exercises by themselves, and then there's layers of like shame, or they feel bad, there's something wrong with them. And I'm like, we need to bring this in and make it playful, right? It's like they're important exercises, but I don't think they need to be so serious.
Yeah. Well, I mean, and you're correct. And then in my, I don't want to say defense, but definitely like in a clinic, like I do kind of want it to be very clinical. Like I'm a professional. I'm talking about your anatomy. We're talking about very intimate anatomy. And in the beginning, I do have sometimes a lot of different partners will come in and like they just want to help and they're just really trying to be so helpful. But I'm like, this person really has no idea what's going on with their own body. And I love the enthusiasm. I love the love. But she might need to do this on her own. Or, you know, they might need to start on their own.
Right. And especially if there's any like their own anxiety when it comes to their body, right? So sometimes with my women, like that outside of if there are actually any physiological issues of just like them getting used to themselves, right? Of just like, you know, if they tense up, even if like going down and exploring their vulva or anything like that, I'm like, you're going to tense up if someone else is down there. If you don't even feel comfortable. Yeah. You know, I always make a joke when I go to the gynecologist of like, they give you the paper thing to cover that always rips, and I'm just like, look, you're gonna look at everything. Could I just sit here? But I know a lot of my women, they're like, they would be completely stressed out at the idea of being that exposed.
Oh, absolutely.
So part of like, I agree with you of sometimes they need to start by themselves.
Which can also kind of like look and feel difficult when that partner is there for that initial appointment on my side of the PT side. And I'm like, oh, I love this. I love this connectivity. But
sometimes there can be pressure from the partner, right? Not like in a malicious way, but sometimes they are excited, they want to get this fixed, but they have to be understanding that it's going to be a process. Yeah. It's going to take time. Yeah. And you need that rapport built up because it's like, you know, you get very intimate in ways with your clients and patients when you're working with them that, you know, they just need to feel comfortable with you before we even get into the exercises, I would believe.
Oh, for sure. And then you also have, like, if you do have, and it's, I mean, I wouldn't say that's like the highest percentage of my population is like people coming in together as a couple. But then you still have two different kind of personalities. And so not to kind of like, you know, gender bias, but like sometimes guys think, or even my competitive people are like, more is better.
Right. Let's do this fast.
Let's do it quickly. It'll end quickly. We'll get done first. Like that doesn't mean it's going to be the best.
Right.
You know, I kind of like always akin it to like just like baking. Like, yeah, you can like speed through baking, but like shit's going to be weird.
Right. And you can't just crank up the heat and bake it for less time.
And if you're sitting here like doing icing or you're doing something, like the first 4 or 5 cupcakes are probably going to be sellable. The next half of that dozen are not going to be sellable. So it's like we have to do little bit by little bit. And then even coming back from, if we are starting with the pain, we have to just go to kind of just net neutral of
Right.
just that number line that my kid learned in first grade of a negative experience to becoming a very fine experience, then tying in the mental health part, the sexual therapy part, the identity, the intimacy,
Sure.
the excitement to make something in the correct moment, in the correct feels. Pleasurable. But we
Right.
can't go from negative to positive.
5. Right, exactly.
Can't do it. It
No.
just doesn't work that way.
No. And I'm glad that you work with partners, because I definitely seen it, like going back to what I was saying of like, if we have to include some of these like manual stretches or that stuff into foreplay, I like that they get the education from you of like what to do, not make things worse, you know, but
Yes.
understanding of like the why behind this is important, and understanding the anatomy themselves. Like us women don't basically know anything going on.
Nobody knows anything.
No, men are definitely not going to know.
Any
You know,
other
it's
private
like
areas.
I'm still learning through this process of working with you of just like all the things.
Yeah. And it's something that, and it is like, it can be a little bit weird, you know, because like obviously like I'm wearing gloves.
Sure.
And usually their partners are like, well, do I have to wear gloves? I'm like, it's not my partner. Like, you do whatever you want. Like,
Right.
I generally don't care. But, you know, yeah. And then they'll kind of stand there and like, it's a very like, what do I do?
Yeah.
I'm like, all right, you're not ready for this. Just go sit back down.
Right,
Like,
right.
We'll come to you when we get back to that net neutral after you've had a conversation, after you've had more
Sure.
therapy. Then we'll kind of bring the partner
And
back in.
I like your scale of like the negatives to the neutral to positives, because going back to what I was saying, it's like with you, they might get to that neutral stance, but as soon as the partner comes in, they could backslide. Maybe not all the way, but now they're back into the negative because they're having to trust their partner to do manipulation or whatever it is, right?
Yeah.
It's like sometimes there's more trust in a professional because you've been trained, you know what you're doing, all these things.
Yeah.
Also with the relationship, even if they don't mean to, sometimes there is trauma or negative feelings because things didn't go well. So now they already have that anxiety, which our body does, right? Like we learn from past experiences, and we will get tensed up. So even if we're trying to do different, like we still have that history that can make us tense, and then we're working against ourselves.
Yeah. And I think a way that I try to once we get toward that net neutral and we're starting to bridge into the bedroom, yes, like my office has like, you know, a mat or a plinth or whatever, you know, the table I use, and I really try hard to like, let's add pillows, like, you know, we can't make it homey, but like, let's lay on your side. Let's pretend that this could become like a sexual posture. Like, let's be on all fours. Let's lean over. Like,
Sure.
Maybe let's not just be
In the
wide
stirrups.
open, you know, in this posture. I mean, that can be a sexual posture, but
Typically,
it's probably not. So
we usually don't start there.
Yeah, we will start there. So, and especially if it is like, you know, pain with insertion or pain with penetration or depth. Yeah, like let's use some different postures, and then you add in pillows or you add in blankets.
Because I definitely say
Yeah.
the pillows for like support and, you know, different positionings and things like that. And the big part for me working with couples too is whoever it is, if it's a male or female working with you, what they're learning, how do they advocate that with their partner of like, if something is hurting or uncomfortable, how do we shift and change gears without it feeling like we're disrupting the mood or that someone's doing something wrong? Because sometimes the partner's like, oh, I don't want to hurt them. And it's like, no, but we have to trust that our partner's going to give us feedback in real time if something is uncomfortable, and we're not just gritting through it.
Yeah, and I think even like just setting, again, just communication.
Oh, yeah.
Maybe not setting boundaries in the, I don't know, in a different respect, but there's different tools. You know, I think we talked about in one of the podcasts, like they make different tools that will limit the amount of penetration you're able to have, so that fear from the partner and that fear from the recipient, like it doesn't, I don't know, that part doesn't hurt, so it doesn't end up being as scary.
Right.
So there's things like that out there.
Or even encouraging the one partner to guide the other person with their, you know, like it doesn't have to be like you're just on receiving. It can be like this, like feedback and guidance through it.
Which I think we're not taught, well, ever.
No.
I was about to say we're not taught on. Yeah, it is. It's a two-way street.
Sure.
And I think that we lose that in a lot of sex because it's something that someone wants. Maybe someone doesn't want it as much or doesn't have time for it, doesn't have the mental capacity for it. And so I think, just having that communication, making it fun and playful, but understanding each other's needs and the things that they can't handle at that moment.
Right. And not relying on they should know what those are, but I feel comfortable enough to voice them in the moment. Because I see that a lot with couples of they're trying to read body cues and things like that if someone's like tensing up or that kind of stuff. And it's like, it would be a lot easier if you just guided them. And sometimes I coach them on how to say it. It's like, don't like suddenly say stop, no, and like, you know, really abruptly, but you know, you can guide it of like, you know, like it feels better when you do this, or you know, I prefer that. Or sometimes we can have boundaries of like, I really don't like my stomach touched, you know, maybe I'm self-conscious about that area, and I'm not ready there to go through that yet, or I'm really ticklish, right? Like that's that's not sexy or pleasurable. So sometimes we can have those zones, and I think we talked in a past podcasts about like sensate exercises, and that's what that is. It's an experiential playground where you can learn what works for you, and then you can communicate that to your partner, and what works for your partner, and then you can take that into the bedroom. And that's also like when you're learning some of the exercises that you'd be teaching them, it's like, let's do those in an experiential place, so if it doesn't work, we don't have the pressure of it working.
No, I think that's you hit on the head.
Oh,
that was
perfect. So I like us working together because it's I focus more on like the communication side, the emotional side, and there's a lot of emotion. Sometimes it's even just processing of why do I have to go through this therapy, right? Of like they feel like there's something wrong with them, and just normalizing of like, no, a lot of people go through this journey, we just don't talk about it. And I think that's why we like doing these type of podcasts and doing these type of conversations of we wouldn't be doing these case studies if it wasn't more of a global issue that we work with.
And this isn't just one patient. This is dozens, if not hundreds of people that pass through our doors and are on some spectrum of feeling this way and having these issues.
Absolutely.
And we're here to help.